Welcome back to Esthetics Magazine. Find more skincare resources at aestheticsmagazine.com. In today's episode, we will be discussing anatomy and hair theory. Hair is composed of a protein called keratin, produced in the hair bulb. This is a swelling at the base of the hair, which fits into a structure known as the hair follicle. The hair bulb is a living part of the hair that is fed by blood vessels and has melanin-producing cells. These cells give the hair its color. As the hair is produced in the hair bulb, it pushes upwards and out of the hair follicle, passing through the oil gland on the way. This oil gland is important because it releases sebum, which is an oily substance. This gives the hair its own protective oil layer. When applied in massage routines, good quality oils are absorbed by the skin cells to strengthen the skin. If hair products and treatments are incorrectly used, the oil from the sebum can be removed, leading to hair and scalp disorders. This is now a common problem that faces beauty therapists, estheticians, due to the widespread use of hair straighteners, colors, gels, and hairsprays. Also, as the hair cells have no regenerative ability, it is important to look after our hair. Hair is composed of a protein called keratin, produced in the hair bulb. This is a swelling at the base of the hair, which fits into a structure known as the hair follicle. The hair bulb is a living part of the hair that is fed by blood vessels and has melanin-producing cells. These cells give the hair its color. As the hair is produced in the hair bulb, it pushes upwards and out of the hair follicle, passing through the oil gland on the way. This oil gland is important because it releases sebum, which is an oily substance. This gives the hair its own protective oil layer. When applied in massage routines, good quality oils are absorbed by the skin cells to strengthen the skin. If hair products and treatments are incorrectly used, the oil from the sebum can be removed, leading to hair and scalp disorders. This is now a common problem that estheticians face due to the widespread use of hair straighteners, colors, gels, and hairsprays. Also, as the hair cells have no regenerative ability, it is important to look after our hair. Hair structure. Hair has different structures and layers that originate from the skin. The hair shaft can be divided into 3 layers. The outermost layer is known as the cuticle. It is composed of hard keratin and is formed of a series of overlapping scales that give the hair shaft strength and protection. The cuticle is transparent and colorless and helps to protect the hair from damage. The middle layer of the hair shaft is known as the cortex. It is made up of long, keratinized cells and is the main part of the hair shaft that determines the strength and elasticity of hair. It contains both the natural color pigment and artificial pigment picked up from dyes. The central core of the hair shaft is known as the medulla. This is only present in thick, pigmented hair. It is a honeycomb of cells that contain both air and pigment, and it gives hair a round shape. However, not all hair has a medulla. The hair is connected to the hair follicle, which is a structure that surrounds the root of the hair. The hair bulb forms the base of the hair follicle and is a swelling of the lower part of the hair. This is where the hair's growth begins and also the living part of the hair. The hair follicle is surrounded by what is termed the inner and outer root sheath. These are made of epithelial tissue that is designed to protect and mold the growing hair shaft as it pushes upwards from the bulb. The erector pili muscle is a muscular bundle, which is attached to the hair follicle and to the dermal tissue. When it contracts, the hair is pulled upright, and the dimpling of the skin, which is often referred to as goosebumps, appears. This muscle is important for warm maintenance and is part of the reason as to why hairy animals often appear larger when threatened. There are many sebaceous gland pores in skin, however, only certain hairs are connected to them. These hairs are known as sebaceous gland hairs, and they are often referred to as having an associated sebaceous gland. This is because they secrete an oil or sebum, which travels up the hair and out of the pore. This lubricates the hair and also conditions the outer layer of the skin. The erector pili muscle is surrounded by the sebaceous gland and both are connected to the hair shaft. However, they are independent in terms of what each of them secretes, and they do not influence each other's function. Hair growth cycle. On the other hand, methods that remove the hair only from the surface of the skin, such as shaving or depilatory creams, are effective no matter which stage of the hair growth cycle the hair is in. This is because hair removal using these methods does not affect the hair that is still in the hair follicle. It is likely that a client receiving IPL treatment to remove hair will have several sessions, spaced a few weeks apart, to make sure that the hairs are treated at the right time in the growth cycle. This is because not all hairs are at the same stage of growth at any one time. It is important for the esthetician to understand the hair growth cycle, as different methods of hair removal are effective at different times in the cycle. For example, methods that remove the hair from the follicle, such as IPL treatments or waxing, are most effective when the hair is in the anagen phase. This is because in this growth stage, the hair in the follicle had an attachment to the hair bulb. That is where the melanin, which absorbs light and heats up during the light absorption process, is mostly found, and therefore the practice is most effective. In order for the anagen phase to begin again, the club hair needs to fall out and the hair follicle needs to start a new cycle. However, it is only when the telogen phase ends and the anagen phase begins that new hair growth occurs. On the other hand, during the Catagen phase, the hair cannot grow. This phase is temporary and occurs when the hair follicle shrinks to about a sixth of the normal length. The lower part of the hair is slowly cut off from the blood supply, so the hair contracts and is eventually pushed upwards. It is at this point that the hair is known as a club hair. The club hair will detach from the hair follicle, and after a short amount of time, the hair moves into the telogen, or resting, phase. This phase can last for several months, and at any one time, it is normal for approximately 10 to 15% of the hairs on the scalp to be in this resting stage. During the anagen phase, the hair is actively growing. This phase can last for several weeks, and the length of this stage plays a huge part in determining the overall length of an individual's hair. How long the growth phase lasts can be affected by a number of factors, including genetic predisposition and whether the person is receiving any hormone treatments. The hair growth cycle consists of 3 distinct stages: Anagen, Catagen, and Telogen. Each hair strand is at a different stage of the growth cycle. At any given time, it is normal for a certain percentage of the hair on the scalp to be in each of these phases. Hair disorders. As hair is not essential for life, it is the last to receive nutritional substances and the first to be affected by internal disorders. The hair bulb of the hair follicle is where the hair receives its nourishment. Therefore, any metabolic changes in the body are reflected by the hair. Some of the common disorders that are able to be visibly recognized on the hair while analyzing your client each time before their service are as follows: androgenetic alopecia, male pattern baldness or female diffuse hair loss; postpartum alopecia; traumatic alopecia; alopecia areata and totalis; traction alopecia; monolithics; seborrheic dermatitis and psoriasis; seborrhea and dandruff; pityriasis; tinea; capitis; pediculosis capitis; furuncle or abscess; pseudofolliculitis barbae, acne and rosacea. When a client has hair disorders, professional help and care of the hair and scalp are very important. The clients need to follow the advice of their primary care physician. If the physician feels that they may benefit from seeing a dermatologist, doctor specialized in the structure and function of the skin, they will refer them to such a qualified professional. Also, it is important that a good rapport, and frequent referrals, is established with the physician based on your expertise and professionalism. It's always good practice to write a detailed consultation and keep treatment records for clients with any visible hair disorders or any open or abnormal skin. These records may be shared with their primary care physician or dermatologist. It will be important both for the client's interest and for further business with the medical and cosmetology professionals involved that you provide accurate, qualified record-keeping and professional follow-through. Always suggest to your clients to decide from options available before considering hair transplant. Nowadays, many hair replacement systems like hair grafting and hair transplant systems have been introduced for those who want to improve their appearance. Not everyone is suitable for these invasive and expensive procedures. Well-trained and knowledgeable estheticians can provide professional advice and scalp treatments in the most comfortable and private setting. For example, the light massage during hair wash increases the blood circulation in the scalp, which provides more nutrients to the hair and boosts hair growth. It's time to level up your skincare product expertise. Are you confident explaining vitamins A, C, and E to your clients? Stop guessing. Get the Essential Guide by Greg Risha, Understanding Vitamins in Skincare. Get your copy today at aestheticsmagazine.com.